Hi, and welcome to your Sigvaris compression product training session.
All right, so I'm going to show you how the COOLFLEX goes on here. We've got the basic liner here that comes with it. One of the things I want to point out is if you pull on that basic liner on the top, you really have very little compression up there. You don't have, on normal socks and on a lot of our competitors' liners, they actually have a keeper thread at the top. So this makes it so it's not going to dig in. This makes it very easy to don too. So I'm, of course, looking to see where that little seam is. That's going to go on the top. Pull this onto the patient's foot. Remembering sometimes those patients have some pretty nasty toenails. And so being careful that those go on without having any problems. I'm going to pull that up and over the heel. And then again, I don't want to just pull this up. I want to kind of place that on the leg, especially if I've got that patient with that fragile skin. All right, so we're looking at the COOLFLEX. Our first marker that we need to look for is right here at the front of it. You're going to see a little stitching. That's going to go right on the front of the shin. We've got our little placement panel, but on this one it's in the back, so a little bit different. But we're going to pull this on. This is what's going to hold that where we want it. I'm going to move that up the leg. All right, so I've got that. We can kind of see there. I'll have you tip your leg towards the camera just a bit. So I've got that centered right on there. And I'm going to pull that up right exactly where I want it. All right, so really simple now for a patient. Our main thing for a patient with this is being able to don that so easily. So this patient would be able to reach down here very simply, grab hold of that, pull it, and get it right to where they want it. So I'm pulling this out to the 30 to 40. But when the patient gets this on, I mainly want to show you what it's going to look like, because so many times when we're out there demoing it, we're demoing with a smaller leg, and so we can't really give the idea of what it looks like, and we end up with the straps clear back here. So here now I've got that on, I can really go through here and I can adjust to get my 30 to 40 that I want. And I'm getting that 30 to 40 by the lines there, going to that second line. But if I look right here, I've got my center back here. The stitch line is going right down the calf nicely. I've got this so it's very, very easy for the patient to get to. So I'm going to ask the patient here, go ahead and reach down, undo those, hook them back up. See how easy that is to be able to do. Real simple, able to lean to the side there and be able to get those hooked in. So hopefully this gives you a little more info about what this is supposed to look like. So when you're demoing this to a patient or to a prospective customer, you can show them what actually is supposed to be going on with the COOLFLEX. One of our newest and greatest products out there. People in hot climates are absolutely loving it. Hope you guys do too. Thanks.